Yeah, so today we're going to conquer a hard topic. We're going to talk about why do people fail, because I had someone in my class fail today because they decided to take the test without me giving them the okay. And I'm okay with that because that person was honest. I tried to tell that student that integrity is the most important thing, but we still want to try not to fail, right? So this is what I said to that student. I'm saying it to you. If you failed this test, this NCLEX exam, we're going to talk about why people failed, but you need to know it's called delayed, not denied. In other words, you're going to do this and you're going to do it right this time, because this is life and death, right? You can't kill patients. Yeah, there's a thought. We should probably know what we're doing. So this is why do people fail. So if you have not taken the test yet, you don't fail because you're listening. And if you have taken the test already, you don't make the same mistake. Now, the person that failed today in class failed 4 times. This is his 4th failure. So now we're going to take it for the 5th time, and we just really desperately want him not to do that again. So here we go. Delayed, not denied. Top 7 reasons why nurses fail the NCLEX exam. Number 1, it has been my experience that more and more students are familiar with all of these software packages available, where you buy this software and they give you 2,000 or 3,000 questions to do, and then you focus on doing those questions nonstop like you've lost your mind. You don't even look at content. You never look at your notes from nursing school. You never review anything about any subject or system. You just believe if I do enough questions a week, I should be okay, right? No. Questions, believe it or not, when you purchase that software and you do all those questions are easily memorized. Yeah. You ever notice how you look at a question that you purchase the software and you look at the question and you're like, I know that one, click. That's not learning. So questions are good because it teaches you how to answer questions in an NCLEX style format. That's great, but it is not content. And we all know that this next generation NG and NCLEX exam is content. It's all content. You've got to know your content. So this is one of the biggest mistakes I see. It's so bad that I've added to my curriculum, I've added the fact that once you watch my videos on content and you filled out the handout and you did the questions, you've got to prove to me that the handout got filled out, because this is a big mistake of students. So again, it's not just why you failed, but I actually have solutions for never failing again. This is easy. Just visit us on Hetv on YouTube to get the content. The content is a must. Don't even do the questions until you get the content. And when you do the content, go to my playlist, and it's subject by subject by subject, organized, so you know your content very well before you take your test. Come on, stay with me. Number 2. I don't know if it's tied with number 1, but it's a close second if it's not. You listen to your friends and family. Family and friends did not go to nursing school. Some of your friends did, but your family, probably not. Everyone is an individual. What worked for your sister, who's a nurse, is not working for you. I have one of my students, her entire family are nurses. They all passed their test. She went through a deep depression because it took her a 3rd time in my class to pass. But she had failed those 2 times, and she went through a deep depression where she didn't want to get out of bed. And that's real. You are not your sister. You are not your best friend. You are not your study buddy in nursing school. You are an individual. I dare say that when you look at this and you listen to friends and family tell you, you got it, just take it. You were smarter than me in school, just take it. No, you're an individual. That's subjective data, right? Remember learning that in school? You need objective data. So for this one, the solution for not listening to friends and family is don't even think about taking your test until you're scoring in the 75s and 80s on your software package that you bought to take this test with. So are you answering NCLEX questions and getting 75s and 80%? Then you have objective data that should help you feel like maybe you could take a test. The other thing with this goes in the same line of it is that you got stuck on a date. Let me tell you something. Don't tell anybody your test date. Stop telling people your business. Don't tell them when you're taking your test. They don't need to know your information because then they're going to hound you. Oh, when you're taking your test, when you're taking your test, when you're taking your test. You just want to backhand them and slap them. Shut up. Don't ask me that. I'm not telling you when I'm taking my test. I take it when I take it, and you would know when I pass it. So let it go. Because you get stuck on a date. Now you've told everybody and their mother-in-law your date. And now you got to stick with the date. And you ain't even ready. So stop, okay? Reason number 3 why nurses failed the NCLEX exam is that they didn't understand what the question was asking. NCLEX questions can be from hell, really. In a way, I almost think a case study, this next generation NCLEX test might be a little better for some of you, because at least with a case study, it's more like real life. It's more like real patients. So when you go and you don't understand what the question is asking, and I'll give you a typical question that people are like, what do they mean, Shelly? I don't know what they meant. They were asking people, which is the patient that requires follow-up or immediate follow-up or just follow-up? People asked me repeatedly, Miss Shelly, what does follow-up mean, right? What does follow-up mean? Because follow-up to some students sounded like you just needed an appointment. They didn't understand that that was a prioritization question of who you see first. There were other vocabulary words that people just didn't understand. They didn't understand words like refute or negate. Those are all words, if you will, that are vocabulary words that aren't even nursing terms, but because people's understanding of vocabulary and their reading comprehension is all over the place, thanks to our country and other countries even, the student did not understand what the question was asking. Let me say this for you. In America, it's the best location in the nation. I get it. I wouldn't want to be born anywhere else, but let's just keep it real all the way 100. In America, your education is only as good as your zip code. Oh yeah, like in my state of Ohio, if you live in Solon, you're getting a great education. If you live in East Cleveland, oh my God, you ain't getting nothing. So in other words, depending on where you were born and where you grew up, you may or may not have the education that is required for the higher level test questions on an NCLEX exam. Don't sweat it, don't get it twisted. I'm here to help you. With my Hetv YouTube station, when you go to the playlist, I teach you those vocabulary words. I teach you those questions that you're gonna see on NCLEX and what do they mean and what was meant by this and what was meant by that. If you're an English second language student, it becomes even more difficult because the typical passage rate is 84% for just the American student. It goes down to 30 to 50% if you're an English second language student. In other words, they have the highest failure rate. Okay, so hear me when I'm talking to you that this is serious. And so it becomes imperative, important, critical that you go to the playlist and just look at subject by subject and do some reading. Reading is going to help. I know people don't like to read now. You want to pull up a YouTube video. You want to do the microwave stuff, but you got to go back to the crock pot. The crock pot was reading. The microwave is, oh, I'll just go to YouTube. You gotta kind of read. Stop trying to sell your NCLEX, your textbooks before you pass your NCLEX. You might have to go back to those books just to get a quick reference. Also, Khan Academy is on YouTube, and that's another good reference for people who are having a little difficulty understanding what is meant by that question. The fourth reason why the nurse fails her NCLEX exam is they completely underestimated the medications. And the medications on NCLEX are all generic. If you don't know the generic names for these medications, there's going to be a problem. And it's very difficult. I still see nursing schools throughout this country that are not teaching all generic names. They're still teaching brand names. In fact, I dare say that some of the instructors that are doing the teaching don't even know the generic names. This is a problem, people, okay? So we're gonna have to kind of get our flashcards out. And as I stated before, let me help you on how to make a medication flashcard. The flashcards, you can buy them at Staples, Office Max, wherever. They're just note cards. On the front of the note card goes the medication by generic name. On the back of the flashcard goes the brand name. On the back of the flashcard goes what does it treat, as well as side effects that we should know about and any antidote that you have to deal with. So let me give you an example. If I put hydromorphone on the front of the note card, on the back of the note card is Dilaudid. What does it treat? Severe pain. How severe? Well, Dilaudid is 7 times more potent than morphine. What else should go on the back? An antidote. Dilaudid is an opioid, so Narcan or naloxone would be on the back of that card as the antidote. All right, stay with me. I'm going somewhere. What is the 5th reason nurses failed the NCLEX exam? Frankly, they failed in the subject of basic care and comfort or infectious diseases. What does that mean? The #1 area of failure in the United States on this NCLEX exam is in basic care and comfort. So you get a report from the Board of Nursing. That report that you get from the Board of Nursing is going to tell you what you failed in. People say, oh, I was close to passing. I got all near. No, actually you weren't close to passing. You're close to passing when you do what my student did. She got all aboves and 1 near. So no, you weren't close to passing because you got all near. That's not close, not by a long shot. If you got belows, oh my God, well that's very serious. You really missed a lot of questions to get a below passing in a certain category. Now, basic care and comfort is very confusing to students, but I'm gonna give you some examples so you know what that is. Basic care and comfort makes the nurse a nurse instead of a doctor or a pharmacist. Let me give you an example. If the question on NCLEX asks about teaching the patient how to manage constipation, and you say, oh, give them a stool softener and a laxative, you just became a pharmacist and a doctor. But if instead you chose the basic care and comfort approach, which includes push fluids, increase your activity, green leafy vegetables or high fiber, then you used basic care and comfort. Another example, if the patient is complaining of heartburn and you say, oh, well then take this antacid, or they're complaining of GERD and you want to give them a PPI, then you've missed the basic care and comfort. The basic care and comfort was don't eat 3 hours before laying down. The basic care and comfort was don't wear tight clothing when you're eating. The basic care and comfort was slow down on how long it takes you to eat. The basic care and comfort was no fried foods, no citrus foods, no acidic foods, things that typically cause heartburn. The basic care and comfort was to teach the patient that 90% of all GERD and heartburn is related to obesity. So working on weight loss would be a good idea. Are you feeling me yet? Basic care and comfort. The other area of failure is infectious diseases. This country has shown that education is power when it came to COVID. And I was literally shocked, and probably so are you, by nurses who were misinformed and believed social media over science. So this test coming up, you know, the NGN, Next Generation NCLEX exam, is going to have more meds and more infectious diseases, because somewhere we went wrong when nurses don't believe the science and instead believe Facebook. So with infectious diseases, I have a whole list of the infectious diseases that you have to know. Remember, it's really important to know the precautions and what to wear before you go in the room and how to take that bad boy off before you come out the room. So all of that I already have in my Hetv on YouTube. Keep up, come on. The 6th reason why nurses failed the NCLEX exam is because they worked too much. Who am I talking about? The number one person that works too much is the number two person that fails the NCLEX exam. This may come to you as a shock, but I've been teaching NCLEX for 20 years plus. I have a PhD in it. This is what I do. I'm Dr. Shelley. So when I tell you why people fail, please believe me. This one's a big one. You worked too much. You didn't take off a week or two before the test. Who works too much? The second person who fails the NCLEX exam the most. The first person who fails the NCLEX exam the most was the English second language student, someone whose first language in their ear at birth was not English. That's all that means. Okay? The second person who fails quite a bit, and you wouldn't think that that was true, but it is true, is the bridge student. Who is the bridge student, Shelley? I don't even know what that means. The bridge student is the LPN who is an LPN first, going back for her RN, taking an RN NCLEX. They have a very high failure rate because of 3 reasons. Number one, they're still working as a nurse, and you know we need nurses, and the money is good, and many of them work for agencies or hospitals, and they don't want to call off, and they're making that long paper because they've already stretched themselves too thin financially. Nurses do it too, believe me. We make a lot of money, but we spend a lot of money. I'm talking to the nurse with the purse. That Louis bag, you could have waited on that till you got your RN. Did not qualify as an LPN for a Louis bag. Get yourself together. Now, they worked so much, they did not prioritize studying for the NCLEX exam. Some of you worked the weekend or the day before your test. That's completely crazy. You need to prioritize this exam. You have to prioritize studying for it. And it's not even just the people work too much. Sometimes you guys are just doing too much in general. What do I mean? Well, you're the deacon at the church and you spend a lot of time, doing things with your church family. You're in charge, you're the matriarch of your family, so you decide you guys have got to go on a cruise right after nursing school because everybody's, sacrificed for you, so you're going to take them all on a cruise. You are PTA chair for your kids' school. You decided that you wanted to be the parent of the year, and each of your 3 children have registered for 3 extracurricular activities. So you're the taxi mom and you're running all over the place. Listen to me. I need you to get to the point where your children want to call 696 Kids hotline abuse number because they've eaten peanut butter and jelly every day. I need you to get to the point where your man is filing for a divorce because you ain't gave him no loving and God knows when, or your girl, your partner in crime, that one. I need you to get to the point where your mama is taking you out the will because you ain't seen her in months of Sunday and ain't called in a minute either. I need you to get to that point because after you pass this test, they'll forgive you. Oh, they will really forgive you. My kids forgave me, honey. They went to England. I sent my kids to China. One of them went to Spelman. Another one went to Ohio State. I mean, you getting paid in a minute. They will forgive you. And you can pay them back with love and gratitude. But you got to pass this test. You can't help them if you don't help yourself. All them people you trying to take care of, you cannot help them until you help yourself. And getting a nursing license is the biggest help they'll ever get. All right, I hope I was clear on that. The 7th and final reason, sort of, why nurses fail this NCLEX exam is they did not join a review course, or, because you don't need a review course, but that's just one example, or they did not start studying immediately after nursing school. Oh no, one person after another tells me how they went on vacation, how they went to Brazil. They thought they needed a cruise. One of my students went to Ireland. I hope it was fun. Listen, you ain't earned none of them vacations. You ain't got that license. So you could have went to nursing school all you wanted to, but until you get that nursing license, you can't even really practice. So stay put, would you? And get to the point where you are just all hands on deck. So nursing school ended last week. Fine. You get 1 week to say, hey, y'all, I'm a nurse. Woo-hoo-hoo. Yeah, baby, I did all of that. Then you back on Monday with the studying. You need a system. You need a system. The system that works the best is mastering one subject at a time. How do you do that? You pull up HETV on YouTube, my YouTube channel, and you go ahead and you go to that playlist. On that playlist is neuro, cancer, GI, peds, maternity, EKGs, cardio, ortho, everything, infectious diseases, everything you ever wanted, respiratory, acid-base, electrolytes. I mean, just, you know, everything, really. I even got videos in there on the burn dance. You know what I'm saying? So systematically, one subject at a time, pull up the video, get some notes, take some notes on that video, do some questions on the actual subject. When you get to 75 to 80% on those questions, go to the next subject. One thing at a time. Now, the name of this video was the top 7 reasons why nurses fail NCLEX. But the main reason some of you may be failing your NCLEX, and this may come hard for some of you, but I gotta say it because I wouldn't be me if I didn't say it. The main reason some of you failed this NCLEX exam is that you're literally not worthy of the crown that God puts on your head when you're a nurse. What do I mean? I mean, when you walk in the room of your patient, they see an invisible crown on your head. See, I don't know if you get it, but for about 15 to 20 years in a row, nurses have been considered the most respectable, most honorable profession on earth. We rose above the police, the fire, the priest, the deacon, everybody. We are the most honorable profession on earth. Everybody keeps voting us in as the #1 most honorable profession on earth. So when you walk in the room and you say, "Hi, I'm Dr. Shelly. I'm going to be your nurse today. I'm going to be with you for 12 hours and we're going to make this day a little better." That crown is there. But what if you're unworthy of the crown? What does that mean? Oh, you want to know what that means? That means lack of integrity, lack of character. Maybe you're cheating on your man. That might be why you failed this test. I know it sounds crazy, but I believe it from my heart because I know how God works. Maybe you are buying stolen property. Somebody yesterday was bragging about their little purse that they got that was, you know, hot, fenced. Yeah, you know what? That purse was stolen from someone else and sold to you. And instead of you having integrity and saying, "I don't need it and I'm not buying it," and it was fake anyway, which is even a bigger issue, right? You know, the fake Louis and the Chanel bags, you know, I already know. Maybe you are sleeping, you know, with the enemy. Who's the enemy? The dope dealer. See, you're living or shacking up with this dope dealer. He's killing people out here with his drugs, but that's your man. I'm sorry, I'm just keeping it real. That may be why you can't pass your test, because you are not worthy of that crown. Yeah, I have somebody in my class that literally told me they were stealing at a local store. And I'm thinking, oh my God, this is crazy. And then just the other day, they mentioned that they had caught a case before that. Guess what? You're not worthy of the crown. You've got to clean that up. Now, don't get it twisted. Oh my God, I'm not perfect. Oh, y'all, I'm going to be honest with you. I had a car accident years ago when I was real young, because I'm 60 now, okay? Just stay with me for a minute. And I call myself driving or whatever. Had this old crazy car accident. Now, it's true, I was tapped in the back. Wasn't nothing wrong with me. My back was fine. My body was fine. My head was good. I wasn't hurt at all. But the little lady came up to my car talking about, "You should be wearing your seatbelt." I looked at her, I said, "Bitch, you hit me. I know you ain't talking to me like that." And then I proceeded to go ahead and lie about back pain, headache, whatever. Get paid, right? Oh yeah, that was stupid, because the very next week up, I totaled my car, hitting someone else. And that little so-called money, after a week after I got my check, that so-called $5,000 was spent on a whole nother car. God don't like ugly, and he ain't too fond about pretty. So let's get our lives together. Let's represent this field of nursing like the angels that God appointed us to be. We are angels of health, mercy, and cures. We can do this, but we got to clean it up. And I'm sorry if that hurt your feelings. that I did my job, because I need to go all the way there with my peeps. Deuces. God bless you. And delayed, not denied. You got this, honey.